Thanks, Brett. Well, it's a problem that's growing throughout the country, affecting our military and someone we may know. Latest stats show that 1 million people attempt suicide every year, and every 13.7 minutes someone commits the act in the United States. Stephanie Contreras is here to talk more about prevention and awareness. Good morning, Stephanie.
Good morning.
Thank you so much for being with us this morning. So tell us a little bit about this month. I mean, it's such an important awareness that we need to bring into the community. Why? Why do you think this is a good topic to talk about?
Suicide touches almost every human being at some point in their life.
Yeah.
And mental illness many times is the cause of a suicide. Mm-hmm. Depression has a lot to do with a person completing suicide and dying with suicide. And this first week of October is Mental Health Awareness Week. Mm-hmm. And next Monday will be the Suicide Prevention National Day of Observance.
And it's so important that people understand this. And in the military, we've seen cases of our servicemen taking their lives. Do you have any information to give us for the viewers at home who are trying to keep up with this trend? Why is it happening?
There are lots of facts regarding military, but especially the fact that in past wars, the military saw less suicides, not more, during wartime. Mm-hmm. But during Afghanistan and Iraq, it has been the reverse. They have seen more suicides than during non-war times. And they're still trying to figure out why and what to do about it, of course.
So the factors are still being debated. How about the fact that, you know, this is also Anti-Bullying Prevention Month, and a lot of the kids, a lot of people, it doesn't just have to be children, who are bullied sometimes turn to suicide. What can you tell us about that?
There are many stories. There's a book out that's called Bullycide. Mm-hmm. It's a new term that they are using, and it's the story of many of the children who have been bullied at school and resorted to completing suicide in order to get out of their situation. There are several warning signs that we need to look for, and we use a little word that says this path warm, mm-hmm. and it means the ideation. Are the people thinking about dying? Are they threatening to die? Are they writing or talking about death? Mm-hmm. Is there substance abuse involved? And a lot of our youth do get involved in the street drugs. Mm-hmm. Is it purposeless that's eating them up? Do they think that there's no hope in their life, no purpose for their life? Do they have anxiety, or they're not sleeping enough? Are they sleeping too much? Do they feel trapped by their circumstances? Do they feel like that there's no hope for the future? There's hopelessness in their life. Are they withdrawing from family? Are they withdrawing from friends? Are they withdrawing from their coworkers if they work? Do they have an uncontrollable rage and anger within them that just wants to explode out, and mm-hmm. they don't know what to do with it? Is there a recklessness in their life that says that they don't care about the consequences? They can't think through their life circumstances to think that the circumstances don't warrant a death. Mm-hmm. And the very last one is a mood change. Are they having constant mood changes when they didn't have them in the past? And these are the warning signs that we need to look for in youth, in our coworkers, in our family members, and military people. If we watch for these signs, we can prevent them from completing a suicide.
If a family member, a friend, someone notices this trend, what should they do?
There are many resources available. The number one thing I want to get across today is that people do not want to die. Research shows that people who have attempted suicide do not want to die. They want the pain to stop. And so what a person should do if they have a family member or anyone else who is showing these danger signs, mm-hmm. they need to call 911 and or MCOT. And MCOT is our local mental health service that has a mobile team that will go out, and we have the numbers available, I think.
Yes, they're right there on the screen. And is this sort of a cry for help? You say that they don't really want to die, so this is sort of a cry for help. Somebody noticed me. Sometimes they feel lonely. Would that be correct?
Yes, that is one of the signs that we have. For another little saying, we have plaid pals. the loneliness. Are they alone at this minute? Do they feel alone, even if they have people around them? Those are warning signs that we need to watch.
Okay, perfect. Well, we're going to talk a lot more with you, Stephanie,
Thank you.
regarding this very interesting topic that is suicide. So please stay with us.
Thank you.
In the meantime, let's send it over to Brett.